I'm Vera Wilt, Supervisor of Riverside Township, and on behalf of the Riverside Township Board and the Riverside Township Mental Health Board, it is my pleasure to introduce the fourth in a series of presentations on mental health-related topics. The Township Mental Health Board has been proactive in providing a wide variety of services through their partnerships with local professional agencies. The services they fund are those that have been identified in a resident survey as high-priority concerns for the community's well-being. The services are responsive to the needs of Township residents, and I urge you to reach out and learn more by visiting the Township's website, riversidetownship.org, and especially see the Mental Health tab on that site. Presentations like this one are meant to create awareness and provide tools to deal with personal, family, and community mental health problems and crises. In cooperation with the Township, the Mental Health Board has created a community resource center, which will be further described to you later in this presentation. Together, they have also created a resource guide which is available on the Township's website and is utilized by first responders throughout the Township to assist people in crisis. The work of the Mental Health Board is an extension of the mission of the Township. People often confuse the role of the Township with the job of their village. Simply put, the Township's role is to provide social services such as general assistance, emergency assistance, senior programs, a food pantry, a nurse's closet, and other health and well-being programs. Riverside Township covers most of Riverside, North Riverside from 9th Avenue east to Harlem, the Hollywood section of Brookfield, an unincorporated Riverside Lawn, and a small northeast portion of Lyons, north of Pershing. See our website, riversidetownship.org, for more information on all our services and programs. We also mail periodic newsletters highlighting upcoming events. As mentioned, this is the fourth presentation in the Mental Health Board series, and if you missed the previous presentations, they can be found on the Mental Health tab of the Township website under Presentations. Today's topic is the first of a two-part series, the mental health implications of caregiving, anxiety, depression, and caring for a loved one during COVID-19 and beyond. This presentation focuses on caregivers for children and teens. Dr. Troiani will tell you more about the presentation and the agencies who have come together to prepare it. Thank you for tuning in.
Greetings. I'm Dr. Joe Troiani, a Riverside Township resident and advisor to the Riverside Township Mental Health Board. Welcome to today's program, the first in a two-part series on the mental health implications of caregiving, anxiety, depression, and caring for a loved one during the COVID-19 pandemic and beyond. As I mentioned, this is the first part of a two-part series. The second part in the fall will again continue to cover the topic of caregiving. Part one is going to be focusing primarily on caregivers of children and adolescents. All the agencies that you will be hearing from today are funded by the Riverside Township Mental Health Board in part. They also partake in the monthly board meetings of the Mental Health Board. The Mental Health Board meets monthly with the exception of July and August, and on the third Wednesday of the month at 7 p.m. here at the Riverside Township building. But it's simply not just a providing of funding. When we meet as a board with our partners, the agencies serving Riverside Township, we're doing behavioral health care planning. We're identifying gaps of services. We're responding to emergent needs. We're creating new programs and constantly asking the question, what can we do collaboratively to better serve those in Riverside Township? Today's focus, as I mentioned, is on caretakers. We've got a number of confronting factors. One, of course, is the ongoing COVID-19 pandemic, or the public health emergency, which we've been in for the last 14 or 15 months. Granted, the news is good. Vaccinations are up. We're developing herd immunity in some sectors, but we're still now having to deal with the psychological fallout or consequences of COVID-19. What we've learned from historical pandemics, the psychological impact can be long-reaching, and in some sectors, the policy sectors and the academic think tanks are saying that we're going to be seeing a surge of mental health issues. But let's take a look at the challenge of the caregiver, which we're concerned about today. The caregiver is having to deal with current as well as ongoing medical and behavioral health challenges. Again, complicated by, of course, COVID-19. And if there's a problem with a COVID infection, exposure to COVID, it makes it even that much more complicated. So the caregiver in the middle of this crisis is having to care for their loved ones. On top of that, they're still managing the family household. And there might be challenges as a result of loss of employment, temporary layoffs, or business failures as a result of the pandemic. So it's managing the family household in the middle of the pandemic. They're also dealing with the issue of, if they have children in school, being the remote schoolhouse. It's no easy task. Talking with both caregivers as well as our own professional staff who has to deal with homeschooling or remote schooling, it's a tremendous amount of additional stress. And in fact, the caregiver is now the defunct instructor. I mentioned employment. Some are blessed to be able to do remote employment from home. So here you're in a situation where you're working from home, being a caregiver, and again, working with the restrictions of this environment. And I mentioned living in a COVID-19 environment, there's fear, there's concern. We're seeing the rates of people who are dying as a result of COVID-19. We're learning about, we're now beginning to learn about not only the short-term consequences, but some of the long-term consequences, both physically as well as psychologically. So again, the agencies have come together and put together a great program looking at caregivers of children and adolescents. So thank you for watching.
Hi, my name is Anne, and my husband and I have 3 school-age children with different mental health diagnoses in the areas of bipolar, mood disorder, depression, anxiety, and ADHD. It's challenging to be a caregiver, especially with mental illness, but my husband and I have been able to lead our family to an okay life despite these challenges. I would summarize my advice to other caregivers in 4 words: acceptance, perseverance, flexibility, and support. I have found that we've had to accept our situation. My kids are always going to have mental illness, and I can't change that. But I'm grateful that we now have treatments available, and some of them are really effective. I've found that accepting setbacks helps me to keep my expectations realistic. I'm always reminding myself that it's normal for my kids to go 2 steps forward and 1 step back. It's frustrating, but it's still progress. I've also learned to accept my kids for who they are, not who I imagined they'd be. I try to focus on loving their strengths, not condemning their weaknesses. It helps me to judge less and leads to a lot less frustration on my part. Perseverance is another good skill that I've developed. I've learned to be an advocate for my kids' needs. I put the extra effort into asking about school services, doctor's referrals, and community resources. It doesn't come naturally to me, but I know that if I don't do it for my kids and family, no one else is going to. We all have challenges in life, but my challenges are my own to figure out how to cope and make the best life I can. No one can do it for me, and I won't find help unless I ask. I like to think of the billions of people who've already lived, all of them having had some sort of suffering to endure, and if they can do it, so can I. I've also learned to be flexible. Because of their illnesses, my kids' moods or realities can flip at a moment's notice, and it becomes impossible to follow through with plans that we've made. So we've learned to accept that our best laid plans need to be flexible, because they will usually need to be changed. Although our extended families don't always understand, especially if we don't show up to a family party, they do know that we put our kids' needs first, and we will set boundaries to protect our kids' health. Flexibility is a kindness to my kids so that they don't have the added pressure of sticking to plans when they're suffering through an episode. And flexibility is a kindness to myself so I don't have to keep trying to do the impossible. Finally, I've found that I need support outside of my immediate family. It's difficult to share personal information like mental illness, but it can really help to share. I found it easy to share with some work friends because they don't have an emotional stake in our home life. I've also shared our situation with certain close friends and relatives, but I found that it's important to filter who I share with. Sometimes my husband and I want to respect our kids' privacy, but sometimes we want to avoid judgment or misguided advice. We've even explained a bit of our situation to our neighbors, especially since they sometimes see the police or ambulance at our house. And we've even learned that several neighbors have close or extended relatives with similar struggles. It has been such a relief to know that there are people in my neighborhood who understand and don't judge. NAMI has also been a wonderful source of support for us. NAMI is the National Alliance on Mental Illness. And it took me a few years to overcome my shyness to reach out to NAMI. But once I did, I felt an immediate sense of relief and belonging. There's an instant bond when you're with people who have lived through similar experiences. And NAMI is as much for caregivers as it is for those with mental illness. The people in NAMI have been a resource for our family to talk through our problems and to ask advice. And we know that we can take their advice seriously because they've been through similar experiences. If you are taking care of someone who struggles with mental health, I strongly encourage you to reach out to NAMI. Along with seeking support from NAMI and the people you know, I hope that you're able to accept your situation, persevere in seeking resources, and remain flexible when times get tough. People before you have been in your shoes and have gotten through it. People in the community want to support you, but can't until you reach out. You can do this. With acceptance, perseverance, flexibility, and support, you can maintain a sense of normalcy and balance in your life.
Well, it's been very difficult with COVID, and I think Helping Hand's been very helpful. Just one, providing the telehealth options for Jack. That's been huge. When COVID hit, we were immediately, what are we going to do? I'm sure with everybody else, but being able to connect with you, being able to connect with Kim, and having those options, and we even not even knowing that connection would be as good as it was, and it's been, and strong as it's been. It's been a lifesaver that he wouldn't have survived this last year and a half without having those options. And we're very thankful that that Helping Hand has been able to figure out how to provide those services, and that you guys as therapists have been able to figure out and provide those services and have that flexibility.
Oh, well, that's great to hear.
That's been outstanding.
Thank you.
Yeah.
Yeah, that's great to
Yeah.
hear. And so what is a piece of advice that you would give to another caregiver who's feeling really isolated and alone and not knowing what to do right now?
Right now, I would say ask questions, that you're in a community, and always ask questions of your providers, of your fellow parents. I know that we're not always together, but as soon as we are together, if you're able to be in a waiting room, strike up a conversation with your fellow parents, just a casual conversation. Some of
Yeah,
the
that's
best
huge.
friendships I've made have been in the waiting room and just learning from other parents. When you have that opportunity, that's an outstanding opportunity to learn from other parents while you're together in that waiting room. If you're not in a waiting room, if there are any groups that you're able to join online to connect with other parents, those are vital
Yeah.
to just get perspective. But always ask questions. Know that you're part of a wide community and that you're not alone.
Hi, my name is Connie. I was asked to share a little bit about my journey as a caregiver. I have 2 out of my 4 children who have struggled with addiction or substance use disorder. So I just wanted to share a few things that have been helpful for me. It can be a very challenging journey with lots of ups and downs, but there is hope. And I think people talk about, taking care of yourself. And sometimes we think about getting a massage or going to a movie or something like that, which I think those are great self-care. But I think the foundational self-care is finding your own recovery. So our loved ones have to find their recovery, but we have to find our recovery too. And when we change, a lot of times it leads to changes in our loved ones. Not that that is the reason to do it, because it might not lead to changes for them, but it can lead to changes for us that can make us okay no matter what's going on with them. And that's my goal, to be okay no matter what's going on with my loved ones. So some of the things that have been helpful for me in that self-care or recovery have been finding some support groups. Al-Anon has been very helpful, even though it's started as something for alcoholics. There are a lot of people whose loved ones have different kinds of substance abuse disorders. So there's a lot of great literature in there, and just people who are in the same place as you and love you and really want to support you. And there's a lot of online meetings right now. I think there's also meetings in person, but probably not so much because of COVID. There's also an organization called partnershipfordrugfree.org. It's a national organization, but they have a lot of helpful literature, ways that you can learn to communicate with your loved one that can change your relationship. And I think that's another thing, is we always want to keep that relationship with our loved one open, even though we don't want to get in the chaos of what's going on with them. Also, there's an organization in Naperville called Path to Recovery Foundation, and they have a Facebook page and some support groups. And if you call their number, they want to help. That's the thing. Like, when you've been in this journey, you are always open to helping other people or giving them, just a few words of hope. And one word of hope I would have is that you're a good parent. Like, there's nothing you've done that has caused this. I think it's hard not to take blame or look at, maybe the things we could have done differently, but it's addiction is, there's a lot of stigma around it, but it's an illness. And I think thinking about our loved one with compassion, that, they're suffering from an illness and they need treatment too. So I would say that, find some support, and it is very isolating, but there are a lot of people who've been there. There are a lot of books and organizations that you can go to. And just, try to keep that relationship with your loved one. Your loved one has a lot more to them than just that substance use. And sometimes I think it's hard to remember that, but just keeping your relationship with your loved one at whatever point you can, but also allowing them to have the consequences of their behavior. So, people will say nothing changes if nothing changes. So those consequences for their behavior is our gift. The gift of discomfort and the gift of, wanting to change. So allow them to feel all of those consequences. Don't take away the gift of pain that can bring about change in your loved one's life. I know this is a hard journey, but there's also a lot of hope. And hopefully you'll join me in deciding that no matter what's going on with your loved one, you want to be okay regardless. Thank you.
For the last 15 minutes, you had the opportunity to hear some very powerful testimonies of caregivers. And these caregivers were provided by Helping Hands, NAMI, as well as Pillars. And we thought in putting this program together, the best place to start off would be hearing from the caregivers regarding the challenges and the experiences they were facing. In this segment, we're going to be looking at caregiving for children and adolescents in the disability community. We have representatives from Helping Hands, UCP Segment, and WSSRA as our speakers. And my first question will be to Jillian over at Helping Hands. Can you briefly describe the services your agency offers, and in what ways has your agency grown as a result of the pandemic?
So the mission of Helping Hands Center is to transform lives through genuine care and education. We provide a comprehensive group of services, but today I'm just going to be talking about our pediatric outpatient clinic. So currently we provide occupational and speech therapy services as well as behavioral health services to children and adolescents through weekly one-on-one treatment sessions. We have grown immensely throughout the pandemic, as now we're able to offer telehealth and virtual therapy services. And right now we're still providing about 50% of our services virtually due to the success that we've had in the convenience as a result of that. We also have robust educational resources on our website for parents and caregivers.
Good. And how about you, Therese? Can you give us a brief description of the types of services your agency offers? And can you tell the viewers in what ways your agencies have grown as a result of the pandemic?
UCP Segment has a Medicaid waiver program that will link families with a case manager, or also known as a self-directed assistant or an SDA. Our SDAs can help link families with respite services, and we also can link families with ADA home modifications, such as bathroom modifications, indoor and outdoor ramping, and van modifications. SDAs can also refer families to UCP Segment or different community providers for day services, behavioral supports, and counseling. During the pandemic, UCP Segment was able to provide online classes, improve its safety and sanitation standards, and provide community outings for family members, such as going on nature walks, classes in the park, and day trips to farms and equestrian programs.
Great. The next question is to WSSRA, but before I start, I just wanted to let our viewers know that the Riverside Township Mental Health Board funds 50% of the tuition for the programs and also funds 50% of the transportation if transportation is needed. Again, another example how Riverside Township supports the agencies in expanding our services to the community. But your question is, can you talk a little bit about the services your agency offers? And in what ways has your agency grown as a result of the pandemic?
Sure. WSSRA works in partnership with 12 local park districts and village recreation departments. We provide recreation services for people with disabilities. Anyone that lives as far south as Riverside and far north as Norridge and has a disability of any age is welcome to do our programs. Currently, WSSRA is having virtual programs as well as in-person programs, and we just started a new family event series as well. So these programs are really designed to build skills, foster independence, make friendships, just create memories, and we feel most importantly it really helps prevent social isolation.
Great. Let's come back to a helping hand. Jillian, what silver lining opportunities have you had during the pandemic to help support caregivers?
Yeah, I think the biggest silver lining opportunity I've seen has been the opportunity for parents to really just grow in their confidence with their own child. So having a complete virtual therapy services, we really rely a ton on the parents to help carry out treatment strategies and participate in the session and really just help the child grow. A year ago, parents were really nervous about doing this. Maybe they previously had been sitting out of their child's therapy sessions and they weren't intimately involved. But over the past year, they've really learned how to grow and engage with their child and learn from their therapist and just really make our sessions more successful and really get to benefit from seeing the growth and really learn with their own child.
Okay, good. And we come back to UCP Segment. Therese, what silver lining opportunities have you had during the pandemic to help support caregivers?
So during the pandemic, the SDAs were able to assist families by finding them COVID testing sites. They were also able to set up appointments for vaccines at our UCP Segment vaccine clinics. The SDAs were also help families link up with technology needed to participate in online classes. There's a lot involved, iPads and stuff like that. They were also able to stay in touch with friends and families, and they were also able to participate in the different classes that were offered by a variety of different agencies. UCP Seguin during the pandemic offered a virtual family support group.
Good, thank you. Going back to WSSRA, Annie, what silver lining opportunities have you had during the pandemic to help support caregivers?
Yeah, so when the pandemic first hit, like everybody else, WSSRA really scrambled to find creative ways to reach out to the families that we serve. Within a matter of days, we launched a series of sunshine breaks, we called them, which were just short interactive YouTube videos, videos that we put up on our YouTube channel as well as shared virtually. Shortly thereafter, we were able to launch a full series of recreation virtual programs. We offered everything from social clubs to dice bowling, bingo. We had the most popular of all was all the dance parties that we had. We also offered some virtual one-on-one chats with staff. Personally, that was my favorite thing because I got to reconnect with some participants that I hadn't either met in the past or that I had known from the past. So I really appreciated that. I think that while we're ready and excited to get back to normal, we do recognize as an agency that not all of the families in our communities are at the same pace as everyone else. So we have decided as an agency that we will continue doing virtual programs as long as the need is there and as long as people are still interested in doing them.
Great. And wrapping up this segment, the question is, and we'll start with helping hands, Jillian, what advice would you give to a caregiver?
The biggest piece of advice I would give is that if you have any concern about your child as a result of the pandemic, to please reach out to one of our agencies to really help and support you. I would say I think a lot of parents aren't sometimes confident in what their gut feeling is, and you know your child better than anyone. So if you have a feeling that just something is not right or something is off, please reach out to your pediatrician, reach out to one of us, and we would be more than happy to support you during this transitional time.
Same question to UCP Segment. Therese, what advice would you give to our caregivers?
Be patient. Applying for a waiver service is a process and it can take some time. And the second piece of advice is just be kind to yourself. It's been a long year and a half and we're coming out of the pandemic. And as things start to open up, take time to do things that bring you joy.
Good. And finally, helping hand, Annie?
I would also like to say be kind to yourself, as well as give yourself a break. WSSRA is here to provide services for your loved ones, so maybe take that opportunity to get some time for yourself, just to rejuvenate your energy. And also keep in mind that if you don't live within one of the 12 communities that WSSRA serves, there's 31 other SRAs within the state, and we'd be happy to connect you with your local SRA.
Great. And in closing this segment, one of the things I would like to share, of course, this has been a challenge for the Riverside Township Mental Health Board. We went from Zoom meetings to meeting in person with social distancing, And I think this June will be our first normal meeting coming up. And one of the things that we take very much pride in is our agencies, how you've responded to the crisis, how you've turned a lemon of a crisis into lemonade, and your innovation, and some of the things that will be carrying on post-COVID-19. It's really a win-win situation for the residents of our township, those that you are serving, and of course, the agencies that you represent. So again, thank you for this segment, and we'll move into segment 2. Welcome back. In our next segment, we're looking at caring for children and adolescents who are struggling with mental issues. Our 2 speakers are from Pillars as well as NAMI. And we'll start out with the first question going to Therese from NAMI. What resources does NAMI provide?
NAMI Metro Suburban provides both support and education for families and caregivers. We have a family support group. We have one that is weekly via Zoom currently, and one that is monthly in person in Western Springs. And we have education classes. So there is a class called NAMI Basics, which is for caregivers and parents of youth under the age of 22, which goes through mental health diagnoses, brain science, medications, communication, and 504s and IEPs. It is a 6-week class in person. It's also available online. And then there is Family to Family, which is an 8-week class appropriate for families with teens and with adults. So it could be a caregiver, a family, a loved one of an adult. And that is an 8-week class, which covers a lot of similar information, but also includes information on crisis management and additional communication techniques. There is also one-to-one family support available from NAMI via phone, in person, or via Zoom, where we can discuss whatever resources a family might need in a particular situation, and also provide support for whatever is going on in the family at that time.
And Trina, I know personally from working community mental health, the importance of these programs, and what's been fascinating over the years is seeing the programs expand and develop and reach out to even a larger community. So NAMI is doing a great job.
Thank you.
Pillars, Anna, what resources, services does Pillars Community Health provide?
So Joe, Pillars Community Health is an agency that is located here in your community, and we provide 3 different lines of services. So we have our Federal Qualified Health Center, which includes medical and dental, and then we have our behavioral health services, which is mental health and substance use disorder services, and then we also have our domestic violence and sexual assault services. And these are all services that are available in the community, and we have hotlines, so that means that they're open and available 24 hours a day. What we're focusing on for this conversation really is our mental health and our substance use services. services. And we want to highlight that during the pandemic, a lot of these services have transitioned to telehealth. And as others mentioned, it has provided access in a different way to our community as we think about folks that maybe were having a difficult time coming in to receive our services. And so we'll talk more about how we've shifted some of our services, but again, we're still in our community.
And my next question is both for Trina and Anna. What makes it difficult for parents and other caregivers to talk with their friends about their children's mental health issues?
So having a child with a mental health condition can be really isolating. Life can be unpredictable. It can be very time consuming. Add on to that isolation due to the pandemic. And then the stigma of talking about mental health issues. Sometimes friends can have misinformation. They may give misguided advice, and parents can really be left feeling invalidated.
Anna.
I think mental health continues to be a topic that we don't understand a lot about, and so there's a lot of, like Trina said, much like misinformation. There's a lot of stigma, and so sometimes it takes a lot of work to explain a condition and to explain what's actually going on with our children that are suffering with anxiety or depression or even trauma and grief. And so a lot of times I think that creates the parents to keep to themselves and kind of suffer alone. And so we are wanting to continue to change that narrative to create what does that network look like for professionally and personally for caregivers, right? We know that that the parents and the caregivers take on a lot of with a child that has special needs in any of our categories, and we want to provide extra support for parents.
Good. This next question is also 4 pillars, Anna. For some reason or another, the child does not want to take part in therapy or treatment that's prescribed. How can you support a child that is not willing to talk in treatment?
So at Pillars Community Health, as in many of the other agencies, we really focus on how can we help the family, right? Because we know that if parents and caregivers are in a good place, then they will they could do more for their children. And so there might be children that are not ready to be engaged in talk therapy, or there may not have the capacity to utilize that intervention. And so we really do encourage the parents to use us as a support. And so, that we can be the therapist or the support for parents while they're navigating their children's behaviors or their children's different challenges that they're experiencing. And so we often say that even if the child is not willing to come in at this time to receive our services, that we want to support parents as in that kind of treatment. And then we also work with all of the other agencies in the community. We're so lucky that we live in a community like this that has different levels of support. And so maybe if we're not the right fit, that we can partner up with one of the other agencies so that, again, we're building a network around your family.
I come back to our earlier discussion that it's been an extremely difficult year for children.
Yeah.
And if children have the challenge of mental issues or substance abuse issues or disabilities, it makes it even that much more difficult. And now we're going into the recovery stage from COVID-19.
Yep.
And we have many challenges up ahead, which is the reason why we're continuing this series as we discover some of the new challenges, as we become aware of some of the consequences that the pandemic has had. So I thank you very much for this segment.
Thank you.
Thank you.
In this segment, we're going to look at caring for children and adolescents who are struggling with substance use issues. We have representatives from Pillar as well as from the Way Back In. And I'll start off with my first question to Chris. What services does your agency, Way Back In, offer to caregivers and family members for those struggling with substance and gambling use? And in what ways has your agency grown as a result of the pandemic?
Sure, Joe. So the Way Back In helps individuals and families in the Riverside Township community recover from substances and gambling with long-term residential and intensive outpatient services, during which people rebuild their lives with a firm, renewed foundation of recovery. Those who participate in our program transform their lives, feeling confident, grateful, and ready to flourish in the goals they have set for themselves. Caregivers, parents, families, and supportive individuals of those struggling with substances and gambling have the opportunity to participate in our family program. Joining a therapeutic group with psychoeducation helps parents, brothers, sisters, and friends all come together to understand just what is happening when someone is addicted and how they can not only help their loved ones, but themselves. Way Back In's family program emphasizes the disease model of addiction, destigmatizing addiction and supporting recovery for the entire family and supportive unit, and creating, implementing, and maintaining healthy boundaries to strengthen and reinforce these vital healing relationships. We also offer an early intervention therapy group for substance and gambling abuse. Parents or caregivers may attend this group for their children, and they may also have their children attend. The early intervention group focuses on education about and prevention strategies for substances of abuse and how you can help your child move onto the right path before their use worsens or the substance or gambling abuse progresses into a full-blown addiction. As for COVID-19, the Way Back In's programs have actually grown immensely during the pandemic. One of the main areas of growth has been in our ability to offer telehealth services to those struggling with substances and gambling and their families from the comfort of their home. We've actually seen a steep increase in outpatient participation and are just so happy that people are reaching out for help during this time.
Good. Thank you. Pillars, Anna, what services does Pillars offer to caregivers and families members who are struggling with both substance abuse and or gambling use? And in what ways has your agency grown as a result of the pandemic?
So as I think about our previous segment of mental health and thinking about the relationship between mental health and substance use disorders, that we continue to, in our agency, focus on outpatient, intensive outpatient services for both adolescents and for adults. And so again, keeping the in mind the family and the support that family needs. And so we do refer back to Way Back In for our individuals that are struggling with gambling addictions. But we want to really highlight that as we've talked about how difficult it's been to navigate the pandemic, that we see you, right? And that we see that the struggle has been real and that these services are available. And, you know, we're fortunate that many people are accessing them, but we know that many more need to know about this information and about these resources. And so, you know, I often talk to families about how we're different people than we were pre-pandemic. We've all had to kind of figure out and pivot and adapt. And for some of us, it's been much more difficult, right? And so we, again, thinking about our experiences pre-pandemic and then how the last year and a half has impacted us. And all of these things then also impact our coping skills, and some of our coping skills are healthy and some are not, right? And so we want to acknowledge that there's been a lot of self-medicating in the last year and a half, and again, how do we, as we continue to move through the pandemic, flag and come on the other side, how do we make sure we're taking care of ourselves to the best of our abilities so we can continue to support and take care of our kids. And so, as others mentioned, because of the telehealth piece, we've had very low rates of no-shows because I think the flexibility and the fluidity of being able to connect with people through phone or through our computers, it's in some ways helped take away some of those barriers that existed. So we continue to also see an increase in need, and I think we'll continue to see that into the next couple months.
Good. Anita, from the way back in, what bright spots or special opportunities have your agencies had during the pandemic to help support caregivers and families?
Well, thank you, Joe. During a global pandemic, it is sometimes difficult to look and think of any bright spots or, happy moments. But like many of my colleagues have mentioned, as our worlds closed in during the pandemic and our lives became so small, the ability to reach out actually became much bigger. We were able to do things that we weren't before. And it was the wonderful opportunity of the communities coming together, and through the help of places like the Riverside Mental Health Board, who really, kind of put everything down and said, this is important. We are going to continue helping people. Unlike many other disasters that we've had before, where financial support was cut off, where we weren't able to continue certain services, the whole entire area of mental health and substance abuse services really doubled down and said, we need to continue supporting everyone who needs help, and we need to be able to continue doing our services, and we did. We spent maybe about a week or two kind of, thinking us out of the box and saying, what are we gonna do? And then we really came in and really did everything that was possible. So telehealth was in many ways a game changer and a lifesaver. For many of our clients and their families, what we were able to see is that we were not only able to reach within the community, but really see so far outside of the community. Some of our alumni were able to participate in many of our groups, and what they were able to do is, even those who moved away, even those who are now living outside of the state or outside of the country, were able to continue participating, and they were able to continue to do. A really bright spot has been that many people who were left out previously out of treatment, out of some of these opportunities, because of transportation, because of abilities, because of childcare, were actually able to now participate, and there were no restrictions. So it really was a bright spot, and my really big hope is that we will be able to continue doing this in some sort of way as we are returning back to some type of normal, and as we are moving on, we will be able to say, hey, we were able to do this, how can we continue doing this? How can we continue no shows? How can we continue being able to serve people? It's not necessarily the same thing, but I know my children's music school did that, where now they're saying, well, you know what, kids can come in and do them in person, but even when you're not feeling well, or even when something's going on, we are now going to have that option of doing it virtually, and so we now know that it works. It's not the same often we do want to do them in person. One other bright spot that we did have is the ability of how much outreach we were able to do during the pandemic. And we had to reshift. We weren't able to do some of the normal, kind of the events and kind of the fun events that we used to be able to do, but we were able to reach out to social media. We were able to do more commercials. We were able to do TV, we were able to do radio, which we really did get a lot of feedback, and we have had more clients calling, we had more family members calling, and it is usually the families who are the first ones to reach out. They are the first ones to kind of receive the information, to acquire information, and so we've also been, we were very fortunate that we were able to continue with the family program, as families do need that support. It is very challenging going through a time when somebody is in early recovery, when someone is just starting to seek treatment. And so families need to be able to rally around each other, and they need to be able to give each other hope and help. And we were very blessed, and we hope that that can continue even post-pandemic.
And our final question is both for way back in, Chris and Anna from Pillars. Might you share with our viewers what supports you would suggest for a caregiver or a parent whose child is battling with gambling and or substance abuse or dual diagnosis, which is co-occurring mental illness or psychological disorders?
Sure. So caring for a loved one, especially your child, when they're struggling with substances or gambling is really one of the hardest things a caregiver or a parent can go through. And that's because aside from providing the resources and caring from afar, a caregiver almost has to let go to a certain degree to the outcomes of their passion and desire to help their child. The largest, most important resource of all is connection. Getting connected and getting your child connected to help heal and foster healthy relationships. Healing relationships with caregivers, parents, and family members, keeping them on their child's side or getting them on their child's side is crucial for a development of a life in recovery. Your child that's struggling with substances or gambling is also not the only one who can live a life in recovery. You can too. Social support, particularly support from family members, is directly correlated with positive, sustained recovery for the child who is struggling. Another important point of support to suggest to parents and family givers or caregivers out there would be to bring the rest of the kids in the family in. Join Families Anonymous, join Al-Anon, or even Alateen for youth. Way Back In has an Alcoholics Anonymous meeting for young people on Saturday nights at our women's facility in Oak Park. These peer support groups provide an outlet to see what you can work on while your loved one is traversing this new terrain of recovery. Lastly, I just want to say that there's no shame in asking for help for yourself or for your child. There is no shame in understanding that your child is battling a disease of the mind, of their very thinking. If you're watching this right now and you're unsure whether or not you should reach out for your experience with your child's struggle with substances, gambling, or a dual diagnosis, or if you feel overwhelmed by feelings of immense burdensomeness, guilt, or shame, please reach out to one of the resources mentioned in today's video. You can call the Community Resource Center of Riverside Township anonymously for a free consultation and referral to an appropriate service or support group within Riverside Township. Lastly, you are not alone. Recovery is possible, and you can recover with your child who is struggling from substances, gambling, or a dual diagnosis.
Beautifully said. And I would definitely support that so much of, I think, where we are right now is that we may think as caregivers, as parents, that our children will never fall to substances. And I think it's being through these kind of conversations and education just to realize how accessible our substances are, whether it's alcohol or prescription medication or other drugs. And so, again, how can we face some of those realities of the world that we live in right now and that our children are navigating, so that we can be honest with ourselves and ask for that assessment, right? And so that on our website, we do have myths about adolescent substance use and misuse. And so I do encourage you, as you hear from all our agencies, to think about some of the information that's out there and how it relates to you and to your family. And as Chris and Anita said, you are not alone. We are here, and you live in a community that has a lot of great resources and a lot of access to resource. So I know at Pillars Community Health, we have bilingual services for Spanish and English, and I know at way back in, they have bilingual for Polish and English. And so again, we want to continue to work with you and with your family in any way that makes sense to you. And so as we've mentioned, recovery is not only possible but accessible, and we really are here to support you. So
certainly the early warning information that we've been receiving, such as alcohol sales and consumption, up 40%, drug overdose deaths up 20 to 25%. The number of drug overdoses has increased significantly. And there's some preliminary information regarding problem gambling online, especially during the pandemic. These are all early warning indicators of problems yet to come. And I'm so glad that we as a community, we as a board, and our partners are addressing the substance abuse issue. We're now going to watch a brief 1-minute community service announcement regarding our Community Resource Center, after which we'll be able to talk to some of our partners in concluding our program regarding the Community Resource Center here in Riverside Township.
With everything that's going on in the world right now, sometimes it can feel like our lives have been turned upside down. Many of us are dealing with health-related fears, job loss, financial difficulties, and social isolation. These can bring on feelings of loneliness, worry, anxiety, and depression, and can strain our capacity to cope in ways that are successful and healthy.
If you need guidance in accessing services and supports in the community, or even just need somebody to talk to, please reach out. We are the Riverside Township Community Resource Center, and we are here to help. Call 708-853-9578 to speak with a community resource specialist who can connect you to services related to aging, benefits counseling, intellectual and developmental disability services, mental health, substance abuse, housing, and more.
We are located at Riverside Town Hall at 27 Riverside Road in Riverside. We are open Mondays, Wednesdays, and Thursdays from 9 a.m. to 11 a.m. and from 4 p.m. to 6 p.m. We are also available on Saturdays from 9 a.m. to 1 p.m. We look forward to talking with you and helping you assess the resources and supports that you need. The Riverside Community Resource Center is a service of the Riverside Township Mental Health Board, and we are proud to be making a difference in our community.
Well, you just had the opportunity to see our public service announcement regarding the Community Resource Center, which was established in collaboration with local agencies, funded by the Riverside Township Mental Health Board, and a service that's available for any and of all of you who are watching this program today. In closing, we've got the boots on the ground, as we say in the military, or in the trenches. Individuals that are very much part of the Community Resource Center. So in closing, any final comments? I'd like to have you share that information with our audience.
Sure, thank you, Joe. So my name is Susan Bertuglia. I'm a social worker at Aging Care Connections, and I'm here with my esteemed colleagues, Chris Ford from Way Back In and Amber Grzeda from UCP Segment, because we are the three clinicians who staff the Riverside Township Community Resource Center on a part-time basis throughout the week. And our little office is actually located right here in Riverside Town Hall at 27 Riverside Road in Riverside. And our job and our primary goal is to connect members of the community with the services and supports and resources that they need. So those resources could be things like the issues that our panelists spoke about earlier, substance use issues, intellectual and developmental disabilities, mental health issues, or they could be things like aging services or a need for transportation assistance or housing assistance, benefits counseling, things like that. So we just want to encourage folks to reach out to us if there's a need. You can contact us by phone at 708-853-9578 or contact us via email. Our email address is crc@riversidetownship.org.
And just to repeat a little bit of what Jill mentioned and that the video just covered before this little closing segment, the Community Resource Center is open Monday, Wednesday, and Thursday from 9 a.m. to 11 a.m. and again from 4 p.m. to 6 p.m. We're also open Saturdays from 9 a.m. to 1 p.m. The Community Resource Center is a service of Riverside Township and the Riverside Township Community Mental Health Board, and we are just so proud to be making a difference in our community.
We'd like to say thank you for tuning in to today's program on caregiving for children. In the future, we'll be bringing another segment to you regarding caregiving for adults. Regardless of your current situation, all caregivers can benefit from some honest self-reflection and building balance into their daily routine. If you are a caregiver, you may have your instinct to just keep your head down and power through your caregiving duties. But you may forget to take care of yourself, your physical and your emotional needs, and that can cause problems in the long run. Remember, you are important. Make a renewed commitment to yourself and your loved ones by seeking out the programs that we learned about today. At the Community Resource Center, we're here to help. And we thank you again for tuning in.
In closing, again, a note of appreciation and a thank you to Riverside Township Mental Health Board, and to our partnering agencies who made the CRC possible, this program possible, prior programs, and of course, future programs, as you mentioned, looking at caretaking and caregiving with adults. Thank you for listening, and we'll have information regarding websites and contacts at the end of this program. Thank you.
Thank you.